Welcome everybody to another episode of the My Kind of Birth interviews. Today I have with me Anna Pino. Anna is a Chinese medicine practitioner, a doula, mother and the owner of Natural Harmony, a traditional Chinese medicine clinic. Now Anna is here today to talk about the benefits of acupuncture in pregnancy and in labour. And I think that this is an important topic because many women hear about acupuncture, but I think they might be hesitant to go and try it just because there is so much conflicting information out there. So Anna, maybe we can start with the basics. Can you tell us what acupuncture is and how it works?
Sure. So acupuncture is the use of very tiny, fine needles that are solid, inserted into different areas in the body. And how it works is it triggers a cellular response in the body around vital organs and biochemical reactions in the body. And so the body then recognizes that there is a problem and where it is and starts to heal itself.
Fantastic. So what are the benefits directly of acupuncture in pregnancy?
Acupuncture is a really safe tool that can be used through pregnancy, and it's proven to reduce inflammation, improve general circulation in the body, calm the mind, and reduce stress levels. So we really can use it safely in pregnancy, and in practice what we observe is it stabilizes and balances out reproductive hormones, and that helps women achieve better birth outcomes and reduce stress levels around during pregnancy and around labor as well.
That's fantastic. And I mean, we know how important those birthing hormones are, not only during labor and birth, but in the last few weeks and days in the lead up to labor.
Yes, definitely, absolutely. And we definitely want to encourage, the oxytocin to flood the body, the mum's body, baby and placenta, and encourage that process as much as we can. I also find that acupuncture is really useful to reduce medication during pregnancy, or as an alternative option for women when they fall sick, with viral or bacterial infections, if they've got a headache or musculoskeletal pains and aches that may be normal through pregnancy but are quite uncomfortable, and morning sickness, nausea, vomiting and so forth. So very headaches, things that come up during pregnancy that women need relief with.
Yeah, right. Wow. So if you can think of maybe the most common concerns for women to come and seek your help during pregnancy, what would be the top 3?
The most common, if I was to name the top 3 that women really recognize acupuncture to be useful in pregnancy, I'd say morning sickness relief and turning babies, whether it's breech or posterior positioning, and definitely birth preparation, commonly known amongst women as acupuncture for labour induction. However, I really prefer to use that birth preparation term, more suitable. Yeah.
Yes, I've seen that birth preparation or getting labour rolling acupuncture work really well this year for a few of my clients, and I was a little bit surprised, but also just completely happy that it works so well. It's fascinating. It just makes it really easy to get that rolling. And I think it's just something else to try for them to release hormones and to release that oxytocin. So
sometimes it can feel like that stage of pregnancy is completely out of the woman's control, and it's just so nice to have something there that is safe and accessible to them.
That's right. So if we think of that birth preparation acupuncture, is there anything women need to look out for? When would they start that treatment?
My recommendation is around 34 weeks is a really good start place to start using acupuncture for birth preparation. The reason being is that research is now showing that acupuncture has really positive effects on softening the cervix. So if we take good sufficient time to start preparing the body and the mind to start relaxing and softening into the birth process, that would be, the results produced would be far more beneficial than doing it at the last minute. It still has positive outcomes if people, or if couples come in around the full term, but I find clinically, and what we observe in clinic is the earlier the better, that we can produce positive patterns within the body and really soften the woman into those, all the hormones that we spoke about, reducing the stress levels as well, and flooding the oxytocin into the body.
Fantastic. Do you reckon there are any side effects or dangers that women should be aware of?
Well, I've mentioned to you, acupuncture has amazing results and you've seen it for yourself. However, I think the effects of acupuncture can be underestimated. I think it's really important to remember that if used prematurely, specific points that we use around full term can produce symptoms of early labour. If we were to do that as practitioners and professionals and experts in that field, we may produce signs of symptoms of labour that may not continue for some women, and it can be seen, acupuncture can be then seen as a form of intervention. So we really have to be aware of that and use those specific points at full term or around 40 weeks. On another hand, acupuncture is a really useful tool in early pregnancy, especially when supporting women's body in early miscarriage or threatened miscarriage. And because the uses of acupuncture, part of the uses is it can influence general circulation. So what we can do is identify if there's certain stagnations in the body and soften those stagnations. For example, we use a really common point that we use is the vertex point at the top of the head. And we use that point to manipulate the circulation, draw the energy and circulation up in order to slow down the bleeding and reduce stress as well. So it's a really useful thing to have. 1 in 3 women experience threatened miscarriage, and there's 50% chance of that pregnancy keeping or retaining that pregnancy. So I feel like acupuncture is such a gentle option for women, especially when there is no current Western treatment for threatened miscarriage. So they can definitely expect to reduce blood loss or bleeding, severe bleeding, really re-energize in that time and preserve their energy and reduce stress levels.
That is fascinating. I didn't know about that treatment.
Yes.
And actually on that point, are there any other symptoms that most people commonly wouldn't seek acupuncture for, but that you have seen that acupuncture is very beneficial for?
Yeah, definitely. I mean, there's a long list of presentations that we can help with and that acupuncture is useful for. The main things that come to mind is things like hypertensive disorders, so preeclampsia, gestational diabetes, anxiety and depression in order to prevent postnatal blues as well. There's digestive disorders like constipation, hemorrhoid support, so itchiness that may come with pregnancy. We've mentioned musculoskeletal symptoms before, and the changes that the body comes with, pelvic instability, hip pain, lower back pain. So many symptoms and presentations that acupuncture can support. And in that, Chinese medicine takes a holistic approach. So we always look at your diet and lifestyle factors and advice accordingly to each woman's individual case. So that's what I love about what we can offer in pregnancy.
Great. So when people are keen to find a Chinese medicine practitioner, have you got any tips on how to seek a professional that fits for them, or that is a good person to go to?
Yeah, definitely. I think it's really important to seek someone who is registered and qualified, and that can, it's definitely a personality match as well. So there's someone that they're comfortable with and someone they can open up with. The main bodies or governing bodies, I suppose, that people can look into is association, and one of the associations is AACMA, and they can search for a registered practitioner on this association. And also APRA, which is the health governing body of Australia, national body of Australia. So they can definitely search for acupuncturists on APRA, which is AHPRA. Yeah.
Fantastic. I love just how I keep on learning new things through these interviews, and that must mean that our audience is learning things too, I hope. So thank you so very much for coming in.
My pleasure.
I think we do have a PDF below the video to just summarize the key points of what we've talked about, and make sure that you can all do a little bit more reading if you like. And I thank you very much for coming around.
Thank you for having me. Lovely to share with you.
Beautiful.